Hello, I am Dr. Uday Kumar Maya, and today we will discuss about dengue fever. I'd like to talk about the origin of the word dengue. It is originated from the word in Swahili, and it means a disease caused by an evil spirit. In 1789, Father Benjamin Rush in the United States called it the break bone fever, for the obvious reason that people have so much of bone and joint pain. He called it the breakbone fever, and this he noticed after the 1780 Philadelphia dengue epidemic. The global incidence has increased dramatically of late, and it is estimated that 40% of the world's population is at risk at contracting dengue fever. This means that over 2.5 billion people are at risk at contracting this particular illness. The World Health Organization estimates that 100 million infections occur worldwide every year. The incidence of this illness is typically found in tropical and subtropical climates and is very classically seen in urban and semi-urban areas. It is one of the leading causes of serious illness and death in children in some African and Latin American countries. But it is not restricted only to these countries. Recently there are reports which are showing the incidence of dengue in Europe, for example in France and Croatia, and even in the United States of America, in the state of Florida, dengue has been reported. Therefore, it is not necessarily a tropical or a subtropical illness, but it's a pan-global problem. You may be interested to know that 15th of June every year is demarcated as International Anti-Dengue Day, so that we can rededicate ourselves to the cause of the management of dengue. The cause of this particular illness is by, very peculiarly as you might know, by mosquitoes. And the causative organism which causes this particular illness is a virus. Therefore, this is a viral infection caused by mosquitoes. There are basically 4 to 5 types of viruses which cause this infection, and a human might contact any of these 5 types of a dengue fever. If one contracts dengue, maybe he will not contract the same illness from one of these viruses, but there is no guarantees that the other 4 types of the virus might not attack him. Therefore, the issue is very complicated in terms of the number of viruses, and immunity is restricted only to that subtype of the virus. The transmission is by a mosquito bite from an infected human being, and this mosquito is called the Aedes aegypti, and the adult female mosquito is responsible for this particular transmission. Rarely this particular illness is transmitted by a blood transfusion and by blood products, and even more rarer is a mother to child transmission through pregnancy. Now, the life cycle of the illness is as follows. The human being is a carrier of the virus as well as the sufferer of the disease. The mosquito bites this particular human being and acquires the virus, and after 4 to 10 days of acquisition of this virus from a human carrier, the incubation of that particular virus takes place in the mosquito, and after about 10 days the mosquito becomes infective, and this infective period lasts throughout the lifetime of the mosquito. The virus moves on to the salivary gland of the mosquito, and whenever a human is bit, the virus is transmitted through the saliva of the mosquito into the human being. Therefore, the human beings are the carriers and the sufferers of the illness. The mosquito is a transmitter of the illness. After being bitten by a mosquito for a period of 4 to 12 days, the incubation period occurs in the human being, and then that particular afflicted human being becomes infective. The Aedes aegypti mosquito lives in an urban habitat. It is a mosquito with a black and white striped body and legs, and it habits in man-made water bodies and containers. It's very peculiar that it feeds only in the day. It is not a night feeder. So typical feeding times are in the morning and just before darkness in the evening. So It's a dawn and dusk kind of mosquito, and the virus which we acquire on being bitten by this mosquito is an RNA virus which belongs to the family of yellow fever, the Casnur forest disease, Japanese encephalitis. They all belong to the same family of RNA virus. Now let's talk about the clinical features of dengue fever. It is a typical flu-like illness. Most of the time it's a self-limiting illness, but occasionally it can develop into a potential lethal complication, and this particular lethal complication causes death in 2.5% of all dengue fevers. This particular lethal form of dengue is called severe dengue, or otherwise called dengue hemorrhagic fever. Unfortunately, there is no specific treatment for dengue fever. The only way we can control this illness is by early detection and by bringing about awareness in health issues. The dengue illness typically starts with a mosquito bite, and like I said earlier, it takes 4 to 10 days for the virus to incubate in a human being and then subsequently manifests as an illness. The typical cycle of the dengue illness is fever followed by being a critical period, then followed by a period of recovery. In most people, the fever is followed by recovery after a period of about a week or 10 days, but in the unfortunate few, the disease might evolve into a critical phase and causes dengue hemorrhagic fever. Recovery, like I said, in most cases is assured, and a small percentage of people get into complications. The typical presentation of a dengue patient would be a patient with high fever to the tune of sometimes 104 degrees Fahrenheit. He may have severe headache, and many people typically report the pain behind the eye, what we medically call retroorbital pain. There can be muscle and joint pain. That is why Father Benjamin Rush called this the break-bone fever. There may be a small bouts of nausea or actual vomiting, and some people may develop a skin rash or a small bleeding spot. This is a typical presentation of an uncomplicated dengue fever. The uncomplicated dengue fever can get troublesome in certain populations. For example, the symptoms which I explained just now, if it happens to occur in infants, in pregnant people, in old people, in diabetics, in hypertensives, or in immunocompromised people, now this particular disease takes a different particular turn. It becomes a little more severe. Now there are certain warning signs which will indicate that this particular patient subset can go in for a complication. These warning signs are typically severe abdominal pain, pain which may be all over the abdomen. There may be persistent vomiting instead of being an occasional vomiting. There can be some amount of fluid collection in the body, like for example swelling of the face, swelling of the feet, bloating of the abdomen, breathing difficulties because water collection in the lungs, etc. The bleeding which I mentioned about in terms of a rash may become more pronounced, and you may have an actual bleeding from the gum or from the skin or any other elsewhere in the body. And clinical examination may reveal a certain organ like the liver may be enlarged, and the platelet counts typically starts falling day on day. These are some of the warning signs that this dengue fever might take a turn for the worse. The complicated version of dengue, otherwise called severe dengue or dengue hemorrhagic fever, manifests by having severe bleeding in the gums. The patient may actually be vomiting blood, plasma leakage into the organs or tissues beyond the blood vascular supply. This particular fluid accumulation can occur in the abdomen, in the lungs. Because of the fluid accumulation in the lungs, the patient may complain of severe breathing trouble. The patient, instead of having high temperature, may have a fall in temperature, what we call hypothermia. The abdominal pain may be so severe that the patient may require painkillers to subside the particular pain. He may have severe fatigability and tiredness, and this particular form of dengue, otherwise called dengue hemorrhagic fever or severe dengue, can be lethal if not attended to immediately. These are the kind of patients which require urgent hospitalization. Now, how do we diagnose dengue fever? Most of the time, the classical fever and associated symptoms, what I've explained just now, happening in a dengue epidemic area and in the dengue season is good enough for us to make a diagnosis of dengue fever. So a good clinical examination is paramount. A good clinical examination will reveal maybe bleeders, maybe small spots of blood on the hand, on the back, on the front of the abdomen. We call this petechiae. And sometimes we do blood tests. In the blood test, what we find is that the WBC count falls and the platelet count typically falls, because the platelets also belong to the WBC family. We call it thrombocytopenia. And there are certain tests which we can do to clinch the diagnosis. One is called the NS1 test, which is positive in the initial period of the fever, that is from day 1 to day 5 typically. Or we can do the immunoglobulin specific test, IgM or IgG, and this is positive from day 5 onwards, and a combination of all of these will make us clinch the diagnosis of dengue fever. Now let's talk about the treatment of dengue fever. In most cases, no specific treatment is required or recommended, and in most of the uncomplicated dengue fever cases, just symptom management and treatment at home is important. It's most important not to panic. It's very important to take plenty of fluids. Take symptomatic therapy. If somebody has fever, he can take paracetamol. If somebody is tired, he can take rest. Therefore, uncomplicated dengue in most cases passes off like any other fever and managed at home. There are a subset of people who can develop severe dengue or complicated dengue, and these warning signs which I mentioned earlier should point a finger towards these persons getting into a complicated state. The typical subset of these people who can be potential casualties would be infants, pregnancy, diabetics, older people, people with very poor immune status. So in an uncomplicated dengue patient, the treatment would entail giving painkillers like paracetamol, controlling fever agents, oral fluids, give them adequate rest for the disease to blow over, monitor clinical and blood tests periodically to make sure that they are not going into a situation where they develop low blood counts or low platelet counts, and typically in a week's time you can expect good recovery. In a subset of patients who develop complications or go in for severe dengue, these patients require immediate hospitalization, and because of their fluid loss into the antivascular spaces, that fluid has to be replenished. They may have an infection because of the various secondary infections which are occurring in the body, so antibiotics may be required. They may have various symptoms. If they have actual bleeding, they may require platelet or blood transfusions. Otherwise, platelet transfusions are not required if there is no actual bleeding. And some patients may require ICU care because their vitals are badly challenged. Now, what about vaccination to prevent dengue illness? There is a version of the vaccination available worldwide, but it is work in progress. It is still not very clear in its usage. Research is very actively going on to attack all the subtypes of the dengue virus, and we are optimistic in the next couple of years WHO should come out with a worldwide vaccine and cause a major impact in the control of dengue fever. In the meanwhile, what can we do in terms of preventing and managing this illness? The most important item is effective vector control. That means decrease the habitat for the mosquitoes to dwell in. So typically in the rainy season or even otherwise, make sure that stagnant and still water is every second or third day evacuated. Make sure that the garden where there is possibly water accumulation is cleaned up so that mosquitoes do not breed in that particular area. The basic idea is to prevent these Aedes aegypti mosquito laying eggs in these water bodies. Environmental management and environmental modifications of these natures are paramount in the management of this particular illness, and we can use vapor solution, we can use mosquito coils, we can use mesh doors, etc., to make sure that mosquitoes do not get in and bite human beings, especially in the mornings and in the evenings. Post-rain surveillance of the household is very important. to evacuate all potential stagnant water. One of the most important things we can do is to educate public and make sure that there is adequate awareness and adequate public movement towards eradication of this illness. So the key points would be stagnant standing water to be evacuated, use insecticides, use window screens with a mesh, preferably wear long sleeve shirts and full pants during the dengue season to avoid mosquito bites. And dengue is a reportable illness, therefore inform local municipal and governmental bodies so that they get an idea as to the kind of fever which is happening in their locality and help towards prevention of this illness in the days to come.